Hi, I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. We just got back from Utah. What a great experience. We had Dr. Gordon Christensen out there, Dr. Robert Miller out there speaking and talking about the advantages of mini dental implants, plus a whole bunch of other lectures at our International Academy of Mini Dental Implants meeting. It was great to see everybody that we haven't seen in so many months because of this COVID nonsense going on around the world. And we just had a wonderful experience. We had 75 doctors come out to Park City, Deer Valley, Utah at the beautiful Stein Eriksen Lodge. We're going to go back there again. That was one of the most beautiful places I've ever been. What do you think, Fitz? Was it great?
100%. One of the nicest places I've ever been.
Fitz is here in the audience, so I just thought I'd ask him. So anyway, we came back here. We were working hard all week, and then I watched the Buffalo Bills lose to the Kansas City Chiefs, and I was so frustrated. But I went home, and I was just starting to reminisce about the past several months and what's been going on in dentistry and our practice. Of course, dental offices reopened June 1st here in New York State, and we were fortunate that we were able to start our residency program, our advanced education and general dentistry program, July 1. And one of our residents is here with me today. Al McCreary is here with me. Say hello, Al.
What's going on, guys? Nice to meet you.
10,000 people watching this interview.
10,000? Oh man, pressure's on.
Pressure's on. But I started thinking about what Al and our other residents have accomplished in such a short period of time, in just 3 months. Al, how many mini implants have you placed?
I think last week I hit 100. In just over 3 months being here, I hit over 100.
100 mini dental implants for a resident who's just out of dental school. What dental school did he go to?
I went to Tufts University over in Boston with your son, actually.
Yeah, in fact, you're a good friend of Jared's, and you were kind of a mentor to him as he was going through his first couple years because you were one of the upperclassmen.
Yeah, he was a great kid. I love helping him out, and he helped me out. He exposed me to you, and basically he's the reason why I'm here today.
Did you take my lecture when I was at Tufts?
I did. Last November, you invited me, you and Jared. I came out here and I took a lecture with you, and I was exposed to mini dental implants. I watched your live surgery, and it was like a dream come true. I saw my future, and I just had to be here. I had to learn from you.
And we're so glad that you applied to the program and that you were able to come here to Buffalo. And I know your home is in New Hampshire, and you spent a lot of time in Massachusetts. But what do you think about Western New York?
I love it. I couldn't be happier out here.
That's excellent. Well, we're really happy to have you. I wrote down a few questions to ask you just because I knew I wouldn't remember all of these. So first of all, here at Shatkin Dental Health, which is our residency program, what does a normal day look like for you?
So basically, we show up 7:30 a.m., get prepped for the day. We talk about patients, we talk about treatment plans, we go over any problems that we had the day before, we talk about future patients that we're working on. Basically, it's our time to huddle in the morning and get ready for the day.
Awesome. And then during the actual day, so give me a typical day. What type of patients are you seeing? What are you doing in a day? I know you said you've done over 100 mini implants. What about other work that you've accomplished here?
So it's really, like I said, it's advanced education in general dentistry. So basically anything on a treatment plan, I can sink my teeth into. That goes for endo.
What about the patient's teeth?
Yeah, nice, no pun intended. So anything from endo, crown and bridge, dentures, anything basically, so even a little bit of ortho.
How many teeth have you extracted, would you say?
Probably close to 200.
200
I haven't counted
extractions,
them out, but yeah.
100 mini implants. What about crown and bridge? How many crowns?
I would like to say I've done some wisdom teeth extractions with you. That was one of the best experiences. Right? Yeah, they're difficult impacted teeth, but yeah, that was a great experience.
What about crown and bridge? Do you have any idea how many crowns you've done?
Probably within 60 or 70. I would say, yeah.
So quite a bit more than you did in your dental school.
Yeah, just a few more. Yeah, I probably graduated with under 20 crowns finished and awesome. Only a couple bridges. So it's been nothing short of a dream come true coming out here.
So what gives you so much confidence to place these mini implants? And would you suggest that a general dentist who's out there getting started with mini implants, what do you suggest to them to get started doing these things?
First of all, it starts with having confidence and being confident in your abilities and knowing the anatomy. If you know those things and you have proper treatment planning and case selection, there's really nothing that you can't do. The sky's the limit.
I 100% agree with you. And you know, we sell these doctors a starter kit at our courses, and sometimes it takes them a year and they've only placed 2 or 3 or 4 or 10 implants. They really got to take the ball and run with it.
Absolutely, yeah. You got to hand off, you got to hit the hole, I guess. But
yeah.
no, I mean, everybody has their own pace, and I have a lot of guidance with you and Dr. Powers, right? So I have a lot of confidence now, but things have changed so much. There's almost nothing that sits down in my chair that I don't feel that I can handle.
Confident, yeah. I 100% agree with you. I'll tell you, you know, when we started this program, I told all of you, there's 4 of you, besides yourself, there's 3 other residents. Ahono Broccoli is one of them. I should say Ahono Gildersleeve, but that's Dr. Donald Broccoli's daughter, who's one of our residents, and Donald is one of our mini implant centers down in Butler, Pennsylvania. We just saw him out in Utah as well. She's got tremendous confidence. She grew up with it. She learned it. But the other 2 residents as well, Thomas and Carmine, are really feeling very comfortable. And I told you all when you started, come and get me if you have any problem. But you rarely come to get me because you have such confidence to go through the whole process and finish it on your own. It's really amazing.
Yeah, no, I agree. We also help each other, and
Yeah.
we have our own strengths and weaknesses. We know our limitations, but I mean, this year is all about expanding those limitations and really being able to get to the next level in practicing dentistry.
Well, that's great. So would you say the other residents here at Shack and Frisk are also placing a lot of mini implants?
Yeah, absolutely. I think Carmine has placed over 80. Ahono has placed over 80 or so, and Thomas, I think, has the most. He has well over 100.
Wow, that's fantastic. So, Al, what are your future plans in dentistry?
So 10-year plan, I would like to have my own implant center. But who knows, maybe I'll stay here in Buffalo and stay at Aesthetic Associates Center.
Well, I sure hope you do. I know I offered you a job the other day. You haven't gotten back to me yet, but maybe on the next Monday Morning Minute we can make a big announcement.
Yeah, well, I can tell you it's pretty hard for me to say no to you, okay?
You're the man. All right, well, anyway, I'm really glad to have Al here with us and also our other residents. And I want all you dentists out there to know that if you have children out there in dental school, they can apply to our residency program here at Shadkin Dental Health through the NYU Langone program. And you can do that right at NYU Langone's website, and then you do it through the match program. Of course, you got to go through the match with ADSAS, but we would love to see your sons and daughters apply to our program here. We have actually a very competitive program. We have over 60 applicants for next year. We're going to take four new students next year for the residency program, but we're very excited about it. But more than that, we're excited that the next generation of dentists are excited about placing mini implants, and we want you to be just as excited. So if you're a young dentist or an old dentist and just getting started with mini implants, don't be bashful, don't be scared. Go for it, do it. You're going to have tremendous results. You're going to change patients' lives every day, and I'm going to be here to help you. So is Dr. Powers, all of the dentists who are with us with the Mini Dental Implant Centers of America, and our lecturers like Joe Gillespie and Matt Lasorsa and Andrea Smith and a whole host of others, Randy Staples. We're all going to be there to hold your hands and help you along the way. So if you've got a kit in a drawer, pull it out and start using it, because this is the time to be successful with mini dental implants. And don't forget about the mono dental implants that we have now, because those are a small diameter mono implant, but they're considered conventional diameters for insurance billing because they're greater than 3 millimeters. They have the abutment on there, and they are a great implant. I've been loving these mono implants. So between the minis and the monos, you can't go wrong. And keep going and keep working hard and stay healthy and safe, and keep your loved ones healthy and safe until this pandemic is over. I'm signing out now. I'm Dr. Todd Shadkin, and I'll see you on the next Monday Morning Minute.
Hi, good morning. This is Fitz. I want to let everyone know that we're going to be having our advanced course via webinar on November 19th, 20th, and 21st. The 19th, Dr. Shadkin and our team of lecturers will give a phenomenal advanced mini dental implant course. And on Friday, the 20th, Dr. Shadkin will be doing live procedures all day. And on the 21st, Our good friend Dr. Matthew LaSorsa will be doing a course that goes from 8 a.m. till noon on the benefits of LPRF bone grafting. He will also be doing live surgery, and he's going to also talk about the benefits of mixing LPRF with Osteogen plugs and strips. And be sure to keep an eye on our end of the year specials. Take advantage of that $179 tax deduction. We have a great offer, the Generate 3D, 2D Bite Wings CBCT machine. We are selling that machine for $65,000. It includes the PX4 portable x-ray machine until the end of this year, till 12/31. If you're serious about placing mini dental implants, having a cone beam machine in your office is very, very important, as most of you know. But the Generate guys, it's a great promotion. We really feel strongly about the precision and the accuracy and the image quality of the Generate. And don't forget, anyone who purchases the Generate 3D Papaya from Shacken First, Dr. Shacken is also going to throw in 3 months of free CT guided stents. So keep that in mind. And please take advantage of that $179 tax offer that you can use up to $1 million this year. So take advantage of that. And we look forward to seeing you on the next Monday Morning Minute.